Well, this morning, there's growing controversy over the Cleveland Clinic's new copay policy, which requires a copay before or at check-in for non-emergency outpatient services. Our Candace Hare joins us live this morning to talk about this. So before we get into all the concerns that people have, tell us exactly what the policy is, Candace.
I can do that. Good morning, Danita. So this policy goes into effect on June 1st. So that's the date you're going to want to circle on your calendar and have in mind if you have an appointment at the Cleveland Clinic either on that day or afterwards, because if you go to that doctor's appointment, you may be required to pay that copay either before the appointment or at check-in. Otherwise, your appointment could be rescheduled. So I want you to take a look at this. These are the types of appointments that this will be applying to. Again, this begins on June 1st. So first of all, scheduled office visits. So think your primary care doctor, any specialists you might see. Also, therapy services. So that's going to include things like physical therapy appointments, occupational therapy, and even speech therapy. Also included will be outpatient diagnostic testing, so any scheduled lab visits that you might have or any imaging, and then any outpatient procedural visits and in-office procedures. Now, Cleveland Clinic is the only major hospital system in Northeast Ohio that is doing this, which doesn't sit right with some who say it adds barriers for people who are trying to receive care.
We talk about, poor people not being able to get their care, but it's really an attack on middle class people because most of the time poor people are on Medicaid and covers their care. But for middle class individuals that are coming in or people who have private insurance and they're coming in and they have a copay, if in a place where we look at ourselves as being the elite above everyone else, that we have really left people behind. They don't have the dollars, then they're not going to be able to be seen. And so that's a hard pill to swallow.
Now, in a statement to 3 News, Cleveland Clinic said in part, quote, collecting all patient financial responsibility for the care we provide, starting with copays, helps us to ensure sustainable hospital operations and supports the seamless delivery of care. Now, Danita, it is worth noting that there are some types of appointments this does not apply to. First of all, it does not apply to any Medicaid patients. It also doesn't apply to emergency care visits, cancer treatments, inpatient surgeries, or for any type of initial doctor visits that you might have for urgent care. I do want to again remind you that this does go into effect on June 1st.
All right, Candace Hare reporting live for us this morning. Thank you.